what Clarity HD is it's kind of the newest generation of this tomosynthesis technology. And at the James, we use this technology at every single one of our imaging sites.
This is the James Cancer-Free World podcast. I'm Steve Wartenberg, and my guest is Natasha Monga. Natasha is a breast imaging radiologist at the Stephanie Spielman Comprehensive Breast Center of the James. And Natasha will fill us in on Clarity HD, a new and even more precise way to take and then read the images that help radiologists detect breast cancer in their earliest and most treatable stages. Welcome, Natasha.
Thanks so much for having me here.
Oh, it's a pleasure. And I'm always curious, how did you become a radiologist? What brought you in this direction?
Absolutely. In medical school, radiology is one of those fields that fewer medical students get exposed to, but as they do, you get to learn just what a great impact and what a large impact radiologists make on patients' health care. So as I went through my rotations, I realized how much I really enjoyed anatomy and how was I going to use that to practice medicine. And when I was exposed to radiology, I really learned the cutting edge technology that radiologists get to use every single day. So whether that be through mammography, which we'll talk about later today, CT, MRI, ultrasound, radiologists are really at the cutting edge of healthcare, and the precision that we can make in a diagnosis is pretty incredible to be a part of.
Yeah, and you mentioned, I hadn't thought of this, radiologists need to know the entire human anatomy because you take images of the entire body.
That's right. Head to toe, radiologists are involved in clinical decision making. And so we interface with patients across all spectrums, physicians across all disciplines. And so radiologists are often referred to as the doctor's doctor for that reason, because we're truly involved in healthcare in every aspect.
But do you now specialize in breast cancer radiology and imaging?
That's correct. And so after my radiology residency training, I pursued a fellowship in breast imaging at Memorial Sloan Kettering Cancer Center. And once I finished that fellowship, I started working here at Stephanie Spielman Breast Cancer Center. And in that role, I have the opportunity to interact directly with patients on a daily basis, whether that be in the screening mammography setting, diagnostic mammography setting, procedure setting. We really have the opportunity to meet with patients from their ideally in preventing and early detection of breast cancer all the way through the treatment of breast cancer and imaging afterwards.
So coming here, and you came here less than a year ago, and you brought someone with you, I understand.
I did. My husband, Vikram Chakravarti, is also a physician here at the James. He's a neurosurgeon specializing in spine oncology.
What was the factor that brought you two here?
We were really compelled to work for a comprehensive cancer center. Both of us are highly specialized in oncology care, and we're looking for opportunities to further that understanding of the treatment of breast cancer, the detection, breast cancer in my case, and the treatment. And working for the James was that perfect opportunity for both of us.
Yeah, that's a good point that you wanted to work for a comprehensive cancer center because it touches every phase of research, treatment, surgery, imaging. I mean, it's comprehensive is the right word.
Absolutely.
So you came here and you're now an expert in breast cancer imaging. What are sort of the basics? What does a radiologist do, and what are sort of the different imaging techniques that you see?
So in breast imaging, the bread and butter of breast imaging is mammography. Mammography is what we use for screening for breast cancer and is really our best tool in the early detection of breast cancer. We also use other modalities like ultrasound to help us evaluate things that we may see on mammography. We use ultrasound in the supplementary breast cancer screening as a supplementary breast cancer screening tool. We use MRI as well. And so all of these methods, when used in combination and together, are really helpful in detection and in treatment.
So the basic, the one that most women would get on hopefully a yearly basis, is a mammogram. What is that technology?
That's correct. So mammogram, for the average risk woman, we recommend, the American College of Radiology and the Society of Breast Imaging recommends starting screening mammography at the age of 40. So what that means is it's a form of X-ray, low-dose radiation, where we expose the breast and look for subtle differences in the breast tissue from year to year that may be a sign of something that we need to evaluate further. And so I can't stress enough the importance of starting at the age of 40 and really doing this every year so we can detect those subtle changes at an early stage.
You're right, starting at the age of 40, but even sooner, right, if you have a family history or a genetic mutation.
That's correct. Yeah. And so what we recommend is that all women by the age of 30 have a risk assessment. And so if women are at a more than average risk, what we call high risk, there are other modalities that we can use that help to detect breast cancer early. And so that's really a conversation that all women should be having with their physicians before the age of 30 to determine their risk. One thing to keep in mind in the average risk setting is 75% of women who ultimately go on to have a breast cancer diagnosis actually don't have a family history of breast cancer.
Right.
So it really highlights that importance of making sure that you're getting checked regularly.
So you read these images, right?
That's correct. So that's what we do all day, every day at the James. We have a team of breast imaging radiologists who do just that. We interpret the images. We make recommendations based off those images. And if those recommendations include biopsies, we also do biopsies every single day. And
you
so
do the biopsy.
That's correct. So
okay.
As breast radiologists, we have a very direct interaction with our patients. So we're often the first to interface with our patients when they're being diagnosed in the biopsy setting. We're also instrumental in localizing breast cancers before surgery. So we use here what are called radioactive seeds. We place those in the breast, or we place wires in the breast right before surgery. And so breast imaging radiologists really get to do quite a bit.
So detecting something in an X-ray, in a scan, is a little bit of an art form. So help people understand, what is it you see that would make you say, this isn't right, we need to do a biopsy? What does it look like?
Yeah, and that's a great question. There are kind of three large categories of findings that we could see on a mammogram that would cue us into something that we need to work up further. Something to keep in mind for all patients that are recalled from their screening mammogram. Just because you're recalled doesn't necessarily mean that you have breast cancer.
Recalled meanings coming
in for more tests. Coming back
for
additional pictures, exactly. And so on a screening mammogram, things that we most commonly look for, masses are an indication that there may be something going on that we want to evaluate further. Calcifications are another possible abnormality that may indicate cancer. And something called architectural distortion is another. And that's just the tissue looking different from other regions of the tissue, of the other breast tissue. So those are kind of, in broad categories, things that we're looking for.
Does it look, and I think I've seen enough, does it look like little white spots, or is it the shape of it? Like what makes you think it's suspicious?
Yeah, and so that's exactly right. So calcifications do look like white spots on a mammogram. We're looking for, in masses, we're looking for shapes, we're looking for margins. We have an entire lexicon called BIRADS that helps us describe those abnormalities. But something for that I can't stress enough, just because you've been called back from your screening mammogram for something that we called a mass or calcifications doesn't necessarily mean that it's cancer. So I just actually wanted to highlight what that means kind of on a large scale. So out of every 100 women that get a screening mammogram, 90 will get a result that say it's normal.
Good. Okay.
10 will be asked to return for either additional mammogram or ultrasound pictures. Of those, 6 will then go on to told that it's normal. 2 will be asked to return in about 6 months to check up on things again, and 2 will be recommended for biopsies. So that's something just to keep in mind in terms of the broad scope.
So 2% of all women will get a biopsy.
You could say that in a screening setting.
Okay. We're going to take a quick break, and when we come back, Natasha will fill us in on the Clarity HD and how that's helping her make even more precise diagnosis.
You didn't choose cancer, but you can choose where to treat it.
And when you choose the James at Ohio State,
you're picking a team of experts who understand there is no routine cancer.
You're opting for care from a highly specialized team dedicated to treating one type of cancer, yours.
A team that studies the unique makeup of your disease to develop a personalized treatment plan.
You're choosing our region's only comprehensive cancer center designated by the National Cancer Institute.
Where more than 1,700 scientists are working on new treatments and new hope for every form of cancer.
At the James, you're making the choice to have the most advanced treatments, many of which were developed right here.
And you're choosing access to the James world-class clinical trials, dedicated support services, and an unmatched survivorship program to support your life after cancer treatment.
You didn't choose cancer, but the choice of where to treat it is clear.
We're back with Natasha Monga, a breast imaging radiologist at the Spielman and the James, and you gave us a great overview of mammograms and the different technologies, and now let's get into this Clarity HD, the next generation. So what is it, and what does it do better?
So to understand Clarity HD, I'd like to take a step back and talk about what is that technology? What does that technology mean?
Okay.
And so Clarity HD is a form of tomosynthesis. Tomosynthesis is known as a 3D mammogram, so a lot of women might have heard about that. And so what tomosynthesis is it's multiple low-dose X-rays that are acquired over an arc over the breast. And what that allows us to do is that the images are reconstructed into planes or slabs, and it allows us as radiologists to scroll through a mammogram as opposed to a single image to look at the tissue in different planes. And so that's kind of how we get that quote-unquote 3D effect is by minimizing that overlapping tissue that might be seen on a conventional 2D mammogram. And giving us a better sense of what might be lying underneath.
So this has been around for, the Tomo 3D has been around for several years, and it's currently the standard that you use?
That's correct. So tomosynthesis was approved by the FDA in 2011. Since then, there's been rigorous study of the technology. And what we've found is that two major benefits is it decreases those recall rates that we were talking about. So decreases those false positives that may ask a woman to come in for additional imaging. So huge benefit in that regard. And number two is it helps us increase the detection of an invasive cancer. And so we've really been able to, by minimizing that overlapping tissue, we've really been able to detect invasive cancer at a significant rate using this technology. And so what Clarity HD is it's kind of the newest iteration, newest generation of this tomosynthesis technology. And at the James, we use this technology at every single one of our imaging sites. So we have 14 imaging sites in Columbus.
That includes the mobile mammogram bus or truck or whatever, right?
That's right. That's right. Including the mobile van. And so that technology, no matter where you get your mammogram, if you come to the James, that's being used. And not only is it the same technology, it's the same radiologists who are reading it no matter where you get your imaging. So even if we are physically at a different location, you're going to be getting those same breast imaging trained radiologists reading those mammograms.
Because they just send it via the computer and it's in the system.
That's right.
Okay. So this type of 3D technology, and now the advanced one, that again, a comprehensive breast center has that, where if a woman's going to a smaller clinic somewhere, it may not be that.
That's right. And so the way that we acquire our images is using this Clarity HD technology, and the way that we acquire them actually reduces the radiation dose by half, by 1/2. And so we use those reconstructed images to increase our characterization of margins of masses. It helps us see certain findings better than we've ever been able to before. And we reduce radiation risk by half, radiation dose by half, rather, I should say, which I know is one of those concerns that patients have.
If you're doing it year after year after year, that's cutting it in half.
Right.
Wow. So what does it look like now if you would compare what you're seeing now with the Clarity compared to what you saw previous to that?
The imaging technology is really has great resolution. So it has 2 times the resolution. Also, it uses a AI algorithm in the background that kind of optimizes the images optimizes the images as we're reading them, and so it can really help us characterize masses in particular better, or that architectural distortion that we were talking about. And so it's really kind of the latest and greatest in our imaging technology.
Now, would it be something that me, being not an expert, if I saw an old one the old way and now the new one, would I be able to tell the difference, almost like looking at an old TV and an HD TV? Is it that significant?
I think what patients would notice is more so the paddle that we use. It's something called smart curve technology. And so the previous paddles were more straight and didn't form around the natural curvature of the breast.
These are the paddles that are pressed against the woman to get the images.
That's right. And so on our mammogram machines, these paddles are all now curved. And so it really the goal is to improve comfort, because that's definitely another thing that women are concerned about when they come in. And this technology, which we also have at every breast imaging center and every place that we do screening mammograms, is this smart curve. And that smart curve really improves comfort.
So we've talked about this before, but I just think we should reiterate the importance of getting mammograms and detecting breast cancer in the earliest stages just has saved thousands or more lives.
Yeah, that's right. And so just a few more statistics to kind of highlight why that is so important. So 21% of breast cancers occur in women younger than 50. Mammography has reduced breast cancer deaths by 30 to 50% for women who obtain screening mammography regularly. And it's really the only screening tool in breast imaging that's known to reduce the rate of death from breast cancer. And so every medical society agrees that the most lives are saved when we start screening at age 40.
Do you find, and this might be hard for you to answer because you're seeing women who come in to get mammograms, but are there still women, for whatever reasons, are resistant? And could be just lack of financial resources to do it, but are there still women resistant who, obviously should be getting them?
Yes. In breast cancer, there are still a lot of disparities in in populations, whether that be by race, geography, financial situations. And so we try and mitigate that in many ways. And so one thing that I think is really important to keep in mind is screening mammography with tomosynthesis, including this Clarity HD technology, is 100% covered. And so there's no out-of-pocket expense to patients who want to get their screening mammogram with tomosynthesis. And so we also have different opportunities for women to get transport to our breast imaging centers if transportation is a challenge. And if mobile mammography works best for you, that van moves around the city. And so we try and improve access and the state.
Because we did have Electra Paskett was on the podcast, and she talked about let's see if I get it right, Pelotonia-funded Turning the Page on Breast Cancer program that is reaching out to underserved populations to provide them with mammograms. It's just exactly one of the things you're talking about. So that's a huge goal of the James.
Absolutely. The goal is that we make sure that women have access to screening because screening saves lives.
Now, this is going to sound like a strange question, but I've actually talked to 2 men who have the BRCA gene themselves, which would mean they would pass it on to their daughters, but also they would have an increased risk of breast cancer. Do you ever do imaging for men, or how often do you do imaging for men?
That's a great question. Not routinely, but we do breast imaging for men, often in the setting of something that they maybe felt that wasn't there before. And so mammograms are offered to men in those settings, and ultrasounds as well.
Yes, because men can get breast cancer.
That's right.
Of course, it's very rare, but so I'd like to kind of finish up by, for you know, this. I can just tell by the way you're talking that you are really passionate about making sure women get their mammograms. So what's it like to get to talk to women and deal with women and give them good news and sometimes walk them through the bad news? What kind of motivates you to be so persistent and passionate about all this?
I think that this is one of the most rewarding jobs for that reason, that patient interaction. And so oftentimes we do get to give patients good news that, you know, maybe they come back for their imaging after a cancer diagnosis and we don't see it anymore.
Yeah.
When we do have to deliver bad news, I think it's important that we stress that you're doing the right thing by getting imaging. We want to catch these things early. And if we catch these things early, we have better likelihood of success. And so that, I think, is very motivating to continue pursuing, you know, talking to you and talking to the community about why we need to be doing this, why women need to be getting breast cancer screening.
All right. Well, we'll keep pressing for that. Well, thank you for sharing that. And everyone out there, the Clarity HD at the Stephanie Spielman is the latest and best technology for when you get your mammogram. So come on over and see Natasha.
Please do.
This podcast is brought to you by the Ohio State University Comprehensive Cancer Center, Arthur G. James Cancer Hospital, and Richard J. Solove Research Institute. For more information, check out our website, cancer.osu.edu.